Good afternoon, everyone. This is Nora Yates with the New York State Department of Health. Thank you so much for joining us. I hope everybody can hear us okay. We are happy to give you this update on the 2019 novel coronavirus and guidance for schools, as well as at the end we'll have time for questions. At this point, we have our participants muted while we give the presentation, and then at the end, an operator will give instructions on how to answer those questions. So without further ado, we're going to go ahead and get started, and I'll hand it over to Brad Hutton, Deputy Commissioner.
Hi, everyone. Thanks for joining the webinar today. We're really happy to provide you with this update on the response to the 2019 novel coronavirus here in the United States and New York. We've really been working around the clock here for the last couple weeks, especially since last Friday when some federal actions were announced that impact all of us. And I know many of you have questions and want to better understand how this impacts all of you. I'll first say, just as a general disclaimer, and especially because we'll be posting these materials, you know, it is very rapidly evolving. Each passing day we learn more and our response activities change. And so really this information is accurate as of today. I wanted to just start by giving you a situational briefing on the current outbreak. Globally, we are seeing more than 20,000 cases now. Almost all of those are within China, and really the largest number, even within China, is within and around the city Wuhan in Hubei province. We are seeing some additional cases in other parts of China with some secondary transmission occurring, but for the most part, it continues to be Hubei province that is most greatest impacted. There are several other countries, several other countries that are reporting cases. It's approximately 24 countries now. This map shows the number of confirmed cases by country. As I said, by and large, it's been China. There are some other countries with couple-digit case counts, but really, for the most part, outside of China, we're talking about cases that have been imported who had recent travel to China or were close contacts with confirmed cases. In the United States, there's a fair amount of testing going on. Currently, all testing is being performed at the Centers for Disease Control Public Health Laboratory. We are expecting that our state public health lab, the Wadsworth Center, and the New York City Public Health Lab will soon have the ability to perform testing here in New York State. But as of now, there's just under 300 individuals who are being tested at CDC. This slide actually is a little behind. We now have 12 confirmed cases in the United States. They are in California, Arizona, Washington State, Illinois, Massachusetts, and Wisconsin. I will say that it is a real success at this point that we have so few cases in the United States. That's probably in large part due to the travel restrictions that were put in place by the Chinese government, and then more recently, restrictions and some actions that have taken place here in the United States to restrict incoming traffic. Those 12 cases have all been among individuals who either recently traveled to U.S. or they were very close household contacts. We do not have any confirmed cases in New York State at this point. We have a total of 21 individuals who have been tested. That's 21 numbers actually inside and outside of New York City. And I think at this point we have 5 individuals that are still pending results. Just wanted to briefly, before handing it over to other presenters, tell you about the response activities we've undertaken here at the State Health Department. We've really been working very closely with federal officials at the Centers for Disease Control, the New York City Department of Health and Mental Hygiene. We've had near daily calls with all local health departments, close collaboration with our colleagues in the State Education Department who are joining us here today on this webinar. Also, colleagues in the Office of Children and Family Services have lots of information on our webpage. Encourage you to check that out at health.ny. I'm sorry.
There's links in here.
Thank you. Links in here. We'll get the right address. There's a coronavirus page in there that we're keeping up to date. Also, an excellent resource is the Centers for Disease Control. We have a public service announcement that our Commissioner, Dr. Howard Zucker, has recently taped, and that should be coming out very soon. And we actually have a call center here as well that we're staffing with health experts. And so that's a resource for the general public, and really any of you who have questions as well could certainly call that. We've been doing a lot to keep healthcare providers and healthcare facilities apprised of the situation. Have been issuing pretty regular advisories, having webinars like this one, and issuing lots of guidance documents. I just want to pause before moving onward to say that really state and local health officials here in the United States have a tremendous amount of experience responding to novel respiratory pathogens, and we really are very well prepared for this. And so I think you should have confidence to know that we are prepared to respond to any additional cases that are found in the United States, especially if one is in New York State. And in addition to battling the virus, I've been sharing this quote that Dr. Jay Butler, the Deputy Director of the Centers for Disease Control, has been saying, because I think it's especially poignant. In addition to battling the virus, we're also fighting three other foes: misinformation, stigma, and fear. And so we really need you to be our close partners, especially in those other three battles. And so really today is an effort to give you additional information and to make sure that we don't have any situations where individuals are being discriminated against because of their country of origin, perceived ethnicity, or because you believe that there is a travel history that potentially places them at risk. I think as you're going to hear from the presenters here today, we really have a process and protocol for identifying individuals who are at risk and as a result need to have certain actions and movement restrictions put into place. So without further ado, I'm going to pass this over to Dr. Elizabeth Dufort. Liz is the medical director of our Division of Epidemiology here at the State Health Department. Thanks.
Thank you very much for having me review some of the background information here and some of our public health information on monitoring and movement restrictions. Oh, sorry about that. Okay. So I am a pediatric infectious disease physician and work here at the health department. However, what I will now be presenting is a little bit of a higher level overview of coronavirus and some of the public health response. As I know, there are administrators and other non-health professionals in the audience today. I want to assure health professionals who may be listening that we have already attempted to include you in all of those healthcare provider webinars, advisories, and any other outreach materials, and we will continue to do that moving forward. So for any school physicians or school nurses and other healthcare personnel working with K through 12, or pre-K through 12 individuals, we will continue to send all of those invites to our SCD partners to distribute through their means, as well as the means we have on the healthcare setting side. So now to review the overview of coronaviruses. So coronaviruses are a recognized cause of acute respiratory illness. Most coronavirus infections manifest as a common cold or a self-resolving mild upper respiratory infection. Coronaviruses are common in animals, certain animals, and animal coronaviruses may cross the species barrier to infect humans. Some coronavirus that have done that and then caused severe outbreaks of acute respiratory disease include the prior SARS outbreak, severe acute respiratory syndrome, in 2003, and the previous and continued MERS outbreak, Middle Eastern Respiratory Syndrome, which began in 2012. And now moving on to a little bit more of information on the 2019 novel coronavirus. As many of you know, in December 2019, China reported a cluster of respiratory illnesses in Wuhan, Hubei province, China. Many of the initially recognized cases had reported contact with a seafood and live animal market. The outbreak was quickly determined to be due to a previously unknown coronavirus. Hence, it was called a novel or new coronavirus. With travel, geographic spread occurred quickly. While there is wide geographic distribution globally at this point, as presented by Brad Hutton previously, no cases have been diagnosed in New York State. And there also is no ongoing community transmission of the 2019 novel coronavirus in the United States. And therefore, currently, although we are very concerned and reacting very seriously to this public health threat, the risk to the general public currently is low. Importantly, I just want to mention, as you all know better than most, I would say, being in the field and on the ground with this, it's also flu and respiratory season. And so we know we also have to address this public health threat and the stigma or fear, as Brad Hutton already alluded to, in the context of many challenges with a very strong flu season this year, and particularly in schools, reports of many schools with challenges with flu and other respiratory illnesses. Spread of novel coronavirus. Much is unknown at this point. Our current recommendations and the CDC recommendations are based on what is known about other coronaviruses, such as MERS and SARS, and there's limited data to date. Similar coronaviruses are spread from person to person mainly via respiratory droplets produced when an infected person coughs or sneezes, and droplets land in the mouths or noses of people nearby, similar to influenza and other respiratory viruses. It is unclear if transmission occurs by touching a surface or object that has the virus on it, and then that individual touching their mouth, nose, or eyes. So it's currently a presumed mechanism of potential transmission, and cleaning is emphasized, as you'll hear later, based on that possibility. People are probably most contagious when they are most symptomatic, but there are reports of spread from an asymptomatic individual patient to a close contact. What are the symptoms? At this point, we know the primary symptoms are fever, cough, and shortness of breath. Other symptoms include muscle aches, and symptoms are thought to occur as few as 2 days after exposure or potential exposure to as long as 14 days after exposure. That's also known as the incubation period. Excuse me. The severity of illness is variable after exposure to this virus and infection. Some people have mild illness that does not require hospitalization. Some persons may develop severe respiratory illness with subsequent organ failure and even death. Diagnosis. The viruses. So that is the seasonal, regular, old school, let me call them, coronaviruses that cause a human common cold. Those tests that test for those types of coronaviruses are not useful for diagnosing, and so including or excluding novel coronavirus. It is important to know that some patients may be tested for the typical seasonal human coronaviruses on standard clinical testing for a respiratory viral pathogen panel. If that's positive for the typical seasonal human coronaviruses, that is not positive for the novel coronavirus. They are different, and they do not cross-react. Currently, only the CDC in the United States has a diagnostic test, a molecular test, a PCR, that is specifically for the novel coronavirus. We do anticipate that our state public health laboratories and large city public health laboratories will begin using the test in the next 1 to 2 weeks. It will still be limited to public health laboratories. Prevention and treatment. So there is no vaccine to date and no specific antiviral treatment. So everyday preventive actions are important to prevent the spread of this illness, if it were in the environment and in the community, in the same way that we address prevention of spread of other respiratory viruses. And this would be recommendations that would be for all respiratory viruses. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol. Wash hands with soap and water if visibly dirty. Avoid touching eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick, and stay home when you are sick. Cover your cough and sneeze with a tissue and throw it in the trash, and clean and disinfect frequently touched objects and surfaces. Importantly, the CDC does not currently recommend the use of face masks or N95 respirators among the general public. Moving on to the public health response to this public health threat, monitoring and movement restrictions. First, to go through briefly some terminology. And this is important because in the lay press, it can get a bit confusing, and it's important to identify how to speak about these issues. Isolation means separating people infected with a contagious disease from people who are not sick. Quarantine is a term used that's about separating and restricting the movement of people who are exposed to a contagious disease but are not yet sick. Often, in either scenario, when we are addressing this issue, we will use the term movement and monitoring restrictions. And typically, there is voluntary adherence to these precautions without the necessity for a legal order. Now to review the federal movement and monitoring restrictions that Brad Hutton alluded to in his introduction. On January 31st, HHS Secretary Azar declared a public health emergency in the U.S. On February 1st, the federal government announced movement and monitoring restrictions on certain individuals. Given the increased risks in mainland China, and so I say mainland China, this does not include Hong Kong at this time. Given the increased risks in mainland China, the federal government decided to implement monitoring and movement restrictions prospectively, meaning from that time point of their implementation date moving forward. There were three categories of folks affected by movement and monitoring restrictions. The first is any U.S. citizen returning to the U.S. who had been in Hubei province, where the city of Wuhan is located, in the previous 14 days, and they would be subjected to 14 days of mandatory quarantine. These were considered the highest risk individuals. The second category is any U.S. citizen returning to the U.S. who had been in the rest of mainland China, again, not Hong Kong, within the previous 14 days, and they would undergo proactive entry health screening at a select number of ports of entry and up to 14 days of monitored self-quarantine, so voluntary movement and monitoring restrictions primarily, to ensure they have not contracted the virus and do not pose a public health risk. The third category is foreign nationals, other than immediate family of U.S. citizens and permanent residents who had traveled to China within the 14 days prior. They would be denied entry into the U.S. for this time. Implementation federally of this process of the identification and screening of these individuals began on arrivals to the U.S. on and after February 3rd. Customs and Border Patrol identified at-risk individuals, and then the CDC screened these individuals at these select ports of entry at these airports to ensure they do not have symptoms of disease that would pose a risk to the public. If they do have symptoms, they would, of course, be treated as such and be cared for in a medical facility under precautions. If they do not have symptoms, the CDC advises them to stay home for 14 days and to touch base and call their local health department. The CDC also provides their contact information to us at the state health department and the local health departments, and those local health departments may contact the individuals. Federal implementation of and identification of these individuals began on Monday, February 3rd. However, the State Department of Health supports monitoring and movement restrictions on individuals who arrived on or after February 1st, that time in early February when the plan was announced. For individuals who arrived before February 1st, these individuals are not necessarily subject to the department's movement and monitoring restrictions. When learning of such individuals, if there are any questions or concerns, a call to the local health department is warranted. The next two slides, I will just briefly review guidance that the New York State Department of Health has developed for local health departments on movement and monitoring restrictions. This is very similar to the CDC movement and monitoring restrictions already mentioned, but I will just show this so that you have an awareness of what the local health departments will be implementing. This is a screenshot of our categories of risk, ranging from high risk in the red to medium in the yellow and green being no risk. And then a bunch of instructions. This is intended not to be readable for you all because it's not anything for this audience to worry about, but rather this is to give you a sense of what the local health departments will use, and it is available to local health departments and other health professionals on our health provider tab of our webpage. So we have worked very closely with local health departments and will continue to ensure full implementation of this approach. And again, this document is just for local health department use. Just to zoom in a little bit more on the part that's of most common relevance to pre-K through 12 schools is the area highlighted in red. And this highlights that the CDC and we at the State Health Department consider travelers from mainland China outside of Hubei province in the last 14 days and without any symptoms, as these are considered as medium risk asymptomatic travelers, medium risk travelers with no symptoms. And in the second category, in the smaller red circle there, you can see that they are asked to voluntarily undergo movement and monitoring restrictions, and that includes avoiding congregate areas, and that includes not attending school or work for 14 days prior to Chinese travel in China. Now just a couple slides on resources from the health department before we get to the state ed presentation. You'll see here is our webpage. We encourage you to go there regularly as things are rapidly changing and evolving, and we will continue to update with new and useful tools and resources and changes as they come down the line. We expect in an outbreak like this that things will change. CDC webpage, likewise, it's changing every day, and so again, reference regularly. We also have some frequently asked questions, as does the CDC, so these links should all work for you. On the right, again, not meant to be readable here per se, but just so you have a sense of, here are some frequently asked questions on the right from our homepage. There's also some on the CDC website, and we will be shortly adding some that involve questions surrounding schools that we've received at the health department. And now I will hand it over to Karen Hollywood for the pre-K through 12 school guidance.
Thank you. First of all, I wanted to begin with thanking our partners here at DOH who've done a phenomenal job in working with us closely and keeping us up to date on what we need to know for the coronavirus. It's been immensely helpful, and I also appreciate them allowing us to participate in this webinar. The first thing that we want to remind schools is that all schools should already have in place an infection control practices and policies. Ideally, that's something that's created with the medical director and the school nurse, and it gives you practices throughout the district on building level infection control practices, plans for monitoring any illness in students and staff, and plans for dismissing any ill people. This, we have a lot of detail on exactly how you should be handling this in the recently released guidance that's available on both the NYSED website under School Health Services or the New York State Center for School Health website, and it's called the Managing Emergency Healthcare and Communicable Diseases in the School Setting 2019. Next slide. Page down. Thank you. So one of the most important things, if you learn anything from today, it's this. If you have any questions at all, such as you're not sure if a student should be quarantined and self-monitoring at home, don't guess. Don't make any decisions. Please, please, please contact your local health department. They have that information. We do not. And we wanted to remind schools, if you learn nothing else in this webinar, that's the takeaway. If you do have any students who are not attending school because they had traveled recently and are self-monitoring at home, we'd like to remind you that since they have to be home for 2 weeks, that it would be strongly encouraged for you to assist them in continuing their education at home. by providing them with classroom work as much as able. This can be done electronically. Sometimes there are school, thank you, sorry about that. There are school web pages such as Blackboard, et cetera, and or least of all, you can always mail it home to the parents. Thank you. The local health departments will be contacting schools. They have the names of people who have to be quarantined or self-monitoring at home, and they will also be contacting you to let you know when those students can return to school if they were self-monitoring at home or quarantined. How this is done exactly may vary by health department, so we would like you to check with your local health department to find out how they plan to communicate this information to you if you haven't already heard from them. We'd also like to remind you that schools cannot determine a student exclusion from classes or any school activities based on race, country of origin, or travel history, including to any part of China. So if you have healthy students at school, you don't have the ability to determine that they can't be at school. Only the local health department can. And again, you can call them and ask. And now we just have some prevention reminders for any kind of illness that I know was already alluded to.
But it's always good to remind you.
But it's always good to remind you, especially with the flu. We've had a number of buildings that have had to close due to high numbers of flu cases. You want to avoid close contact with people when you are sick, and generally that's about a 6-foot rule. You want to stay home when you're sick. That's really important. Covering mouth and nose with a tissue when coughing and sneezing, and then throwing that tissue in the garbage. Cleaning your hands, avoiding touching your eyes, nose, or mouth, and always practicing good health habits, such as encourage students to get plenty of sleep, be physically active, manage stress, and eat nutritious foods. And a lot of that is already covered in our health education classes, but it's a good time of year to just remind them. Schools can also clean and disinfect frequently touched surfaces at home, or at school, and you should check with your custodial department if you have any questions how they are to do that, because they have that information. We want to encourage everyday preventative actions to stop the spread of germs, so we're encouraging you to teach students to cover their coughs and sneezes, that if they've used a tissue to dispose of it properly. Please provide adequate supplies in the classrooms when you're able to, including tissues and the trash cans, and also teach students to keep their hands out of their faces, and especially their eyes, nose, and mouth areas. One of the most important things that schools can do to prevent illness is to teach students to wash their hands. So we put down here a list of when to wash the hands, which is always before, during, and after preparing food or before eating food. I'd like to remind schools that if soap and water is available, please let the students learn how to use that and not just go to alcohol-based hand sanitizers. The alcohol-based hand sanitizers really need to be reserved for when there is no available soap and water. And then we have other conditions such as when they blow their nose or cough or sneeze right into their hands, you want to remind them to wash their hands. Finally, we have some information from the Centers for Disease Control on how to wash hands and when to wash hands, and so we just put them up on the slide to just as a general reminder. We've done this before, but it's never too many times. So we're going to give you the quickest way to teach kids is 5 steps, and we're just including this on the slide to remind you of those 5 steps and to encourage you to teach them to implement those at school.
Great. Thank you, everybody. Thank you so much. And now I just want to go wash my hands. So we are going to, we see some questions on the Q&A on the webinar, but we're going to go to the phone. Operator, can you instruct our participants on how to answer or ask questions?
Yes, ma'am. As a reminder, to ask the question, you will need to press *1 on your telephone. To withdraw your question, press the pound key. Again, if you would like to ask the question, press *, then the number 1 on your telephone keypad.
While we're waiting for the first question to come in on the phone, I do have one that came out in the chat regarding a different country, and it relates to a child traveling to Taiwan. Is that included in this?
Taiwan is not currently included in this. Again, please keep checking back regularly as this could evolve over time. currently mainland China, and then the higher risk group being Hubei province, where Wuhan city is located.
Great. There's another question that we saw was, how do I know who my local health department is? There was some guidance that came out from the state education department, Department of Health earlier this week, where there's a link there. There's also, if you go to the state health department website, we have a link there on our novel coronavirus page and actually all over our page. So health.ny.gov, which is the state health department page, and then we can, there's a link there. And then if you tell us where you are, we can tell you who it is too.
County.
And we can add it actually, I'm assuming the slide set will be shared with participants, and we can add it actually, if it's not already here as a link, we can add it to that slide that has that telephone picture on it so that folks know where to call.
Yeah, and every county has a local health department. And so I think if, you just look up where your county is and then you can find that information if you're having trouble on our website.
If you're in multiple counties, you can approach both health departments. I'm sure that they're collaborating on the response here. So if you are in multiple counties or do cover a school district that covers multiple counties, we would encourage you to engage both to ensure a coordinated response. Operator, are there first questions?
Yes, ma'am. Your first question comes from the line of Lynn Eves. You may ask your question.
Hi, good afternoon. Thank you for hosting this webinar. I have 3 students in my K through 5 elementary school who are currently in mainland China, and they are scheduled to come back on the 17th of March. I have already been in contact with my local health department concerning the students, but my question is, if they take an earlier flight or if they come in the weekend, how is it communicated to us that they have been issued a self-quarantine? Because my understanding from what the CDC recommendations are is that's sort of what I'm anticipating, that they will have some sort of self-monitoring since they are traveling from mainland China. And what is the process if they show up at school and I have not been in contact with the health department? What are the steps I should take?
So
I'll cover the first part.
Yep.
Yeah, so the individual will be, all of the flights from China are funneled by Customs and Border Protection and the airlines through specific airports. There's 11 airports. JFK and Newark are the ones closest to our region, so most often those are the ones where New York State residents will be coming through. And CDC has staff on site there. Customs and Border Protection identifies those individuals coming from China, even if it's an indirect flight and they're coming through Europe or what have you, and then flags them as being identified as needing screening. They're then passed on to the Centers for Disease Control staff, who screens them for any symptoms. And if they're asymptomatic, provides them with educational materials in English and in Chinese and Mandarin that specifies that they should stay home for the next 14 days and themselves that they should contact their health department. As an added measure, in case those individuals would not necessarily immediately contact their health department, although we've had many do that, as an added measure, the CDC is also providing state and the New York City Department of Health, and we provided the local health department lists of these individuals so that local health may get in touch with them. And then local health also may, depending on the local health outside of New York City, will then initiate transfer of that information to the school for awareness, is my understanding. As far as if they show up at school, I'll let SCD take that away.
Yeah, if they show up at school and you have any questions, you need to contact the local health department. So that would be the county that the school building is sitting in.
Yeah, but my question is, what if they come on a Sunday? How fast is that transfer of information going to occur?
That's a great question. So over this weekend, and earlier this week, when CDC was very quickly standing all of this up and implementing it, it was not a particularly fast process. And so we have heard of some scenarios that could be a bit challenging, not with anyone showing up at school, but where individuals have called their local health department because they received that education before the health department received their name, and then they adjusted appropriately. However, now things are moving quickly, and we've received notifications from individuals arriving today. So it should be a quicker process. But again, they're handed the materials as well to address both sides. And please remember also that they've already been screened for symptoms. So these are not symptomatic individuals. So really this is all considered public health protective measures, ensuring an overabundance of caution to ensure the safety of the public, but these are not symptomatic individuals. And they also receive materials and are told if they become symptomatic to not go out of their home and to go to a healthcare facility, calling the healthcare facility in advance.
And this is SED. Just a suggestion is while you're talking to the local health departments, make sure that they have your most up-to-date contact information, and make sure at least the superintendent's contact information is readily available to them so that they can reach out to the district should they get a name of one of these persons that needs to stay home.
I should mention too, this is Liz Dufour, from the public health side, we also have processes in place for ongoing active monitoring. Active monitoring means that public health reaches out once daily to these individuals for outside of New York City public health, and so that also will be ongoing. So there is, interaction and daily communication, ensuring that everything is working as it should.
I have one other question. So if the students do return after the expected quarantine period, and they're okay to be back, and then within 2 weeks later they have a fever because now they have flu that we have all over, is that something that needs to be called in? Like, what is the precautions with something like that?
If the symptom onset is after that 14-day time period after last in China, then you would just approach it as you would normally for any other local child.
Okay.
Or adolescent.
Operator, do you want to move on to the next question?
Yes, ma'am. Your next question comes from the line of Cheryl Wolf. You may ask your question.
Hello. I just wanted to know, I know this is still all very new, and clearly you've outlined that a mode of transmission would be like directly coughing into someone's face or sneezing. Do we know if it's suspended in air for any length of time?
That's a great question. So currently, in order to protect the public and with an abundance of caution, CDC is recommending airborne precautions when individuals enter a healthcare facility. And so that is, and the approach that we are taking if someone is ill in EMS or once they enter a healthcare facility, we do recommend that. But the data is not there yet. And the feeling is that most coronavirus is more droplet precautions, not airborne, but this is to be cautious.
Very good. Thank you.
Your next question comes from the line of Patricia Goldway. You may ask your question.
Hi, good afternoon. I am also in a similar situation. I have a student who is traveling in mainland China due to return the end of February. This whole process that you described seems to take quite a bit of time to me. By the time CDC notifies the state health department and they notify the local department, and you made a point of saying the local department may or may not contact the school. And that concerns me because I have a document from New York City Department of Health and Mental Hygiene. The commissioner wrote a statement, and he absolutely said that people who left China after February 2nd, 2020, those individuals should not report to school or work for up to 14 days from the date that they departed China. That seems a little bit stronger than what I'm hearing on this webinar. And that concerns me because
I would say we agree with that statement from the Commissioner of Health for the New York City Department of Health and Mental Hygiene. We agree with her statement. And I think the difference is that our state ed department is highlighting that it's not for the school to start seeking out individuals who may or may not have traveled to Thailand or China and start getting into public health work, really, that it's for the public health side to do. And so that is why in New York State we are taking the approach of a more, in the rest of state outside of New York City, a more aggressive stance than even CDC recommends, where we are having public health get in touch with these folks directly, as well as the CDC handing them the card to contact their local health department. We're also developing a text-based solution to text them reminders every day to ensure if they get sick that they don't leave their home and that they're not leaving their home anyway, and checking on them. And so we're engaging in multiple pathways to ensure this all takes place. Additionally, like I said, I think at 10 a.m. I received some notifications from CDC about travelers arriving this morning. So these are now happening promptly.
So the
That's
sorry,
yeah, that is good. But we're not seeking out people. In this case, this family told us that they were traveling and they would be back. They told us before the coronavirus broke out.
Yeah, so it's a great point. So we don't know.
Stay home.
And they will be told that when they come back through.
What's that?
And I think on the movement and monitoring restrictions that Dr. DuFour outlined, because they are coming through from mainland China, they will be instructed of that, and that information will be given to local health department, and they will be recommended based on where they were traveling and recent attendance or presence in China to be self-isolating. So, yeah.
Right, but I won't know. I could possibly not hear from all those departments at all that these people are self-monitoring and the child could be in school. And I'm faced with a situation where other parents of students in the class know about this, not from me, but from classmates or whatever, and this could be a big concern when that child is ready to return. So I'm wondering how fast this whole process can be expedited. That
as
should
you
be
just
able
said,
to.
the process is very fast. I mean, they're finding out within hours who's arriving and whether or not they need to stay at home. Then the local health departments will have that information within a very short period of time. So all of this is
But what is that? Is that a day, a half a day? You know what I'm saying? To get this all in place? Hours.
It's hours.
Okay.
So if you have any question, if this child shows up at school and you are concerned that they should be at home and they're telling you no, then you are to get on the phone with the local health department and find out what's supposed to be going on with this child.
Yeah. The thing is that child could be on the bus on the way to school already. That's my concern. I'm wondering if proactively...
Well, there's nothing you can do about that at that point in time unless you wanted to let the driver know that this child that you know is there quarantined. But if you're not sure that they're supposed to be quarantined and they happen to come to school, then once you find that out, you are to contact the local health department.
Okay. All right. But that's the best we could do right now. Thank you.
Mm-hmm. Your next question comes from the line of Laurie Bullock. You may ask the question.
I have just a very quick question. Can you please tell me how many documented cases again in the United States? I think you said there was 12 documented?
That's correct. I made these slides, 24 hours ago or a little more than that, and so it says 11. I apologize, but
okay.
It is 12 now. They were just the screenshot we took from the CDC at the time the slides were made says 11, but it is 12 now. Yep.
Okay. And are there recommendations of sending any kind of information home from the school to parents regarding the coronavirus?
Right now, there is a sample letter that we sent out Thursday night along with the joint letter from SED and the DOH. So that should have been in your email. You want to check? If not,
I did see that letter. Are you recommending that we send it out or not? Yeah.
That's a local decision for you to make. It's a template we need to develop with the current accurate information, but you don't have to. It's totally your choice.
All right. Thank you very much.
Mm-hmm.
Your next question comes from the line of Lorraine Marshall. You may ask the question.
Hello? Yes, can you hear me?
Yep, we can hear you.
Oh, yes. I was just asking the question, can the slides, I think it was answered online, are the slides going to be available from this presentation through email, but I was told that it will be on the CDC website?
We can distribute it, and it will be on the Department of Health, New York State Department of Health website.
Okay, that's great. Can the Q&A from this presentation also, the transcript be sent or?
Recording? Is it recording?
We are going to be recording the webinar. So we are doing the Q&A. The entire webinar is being recorded, and so on the recording, the questions and answers will be on there.
Okay, I think I heard the answer to this question, but I'm not sure. Is it necessary at this time to send out, if there's no incidences? I'm in New York State. I'm in Buffalo, New York. Is it necessary to send out coronavirus notification to parents right now for information purposes, or not right now? I mean, I don't want to.
Yeah, we gave you a template letter for you to choose to send out if you feel you need to for your particular community. So it's a local level decision at this time.
Okay, more so local. So we should, I would refer to the county health department then, you're saying?
No, it's completely your decision at this point. I mean, as we said, there are no active cases in New York State. So if you feel that your community is sounding anxious and asking you a lot of questions, then you may want to consider sending it out.
Okay. All right. Thank you.
Sure.
Your next question comes from the line of Abby Breen. You may ask your question.
Good afternoon, and thank you. Actually, most of my question here has been answered with previous discussions. One thing, though, that I was wondering is also, do we know yet how long or the virus may live on surfaces? We talked about the cleaning and the of whatnot of desks, et cetera, at school. Is this something that we are aware of yet, or what?
We don't know that exact information yet, but based on limited data to date and prior experience with other coronaviruses, we will be putting out guidance on cleaning in the next 24 hours or so. It should be on our webpage. And so that will assist folks in how to clean if there is any concerns that, let's say, for instance, this was a healthcare setting or this was an individual who was being evaluated for this condition in their home, that guidance document would address those most serious concerns. However, the routine cleaning performed that's already been mentioned in the SCD aspect of the presentation should be sufficient for the routine cleaning of coronaviruses, ensuring you protect the public as much as possible.
And just to clarify, when I did mention the cleaning, it was just over general illness prevention practices in general, not specific to coronavirus. So, right now we have the flu, so it's good practice.
Oh, yeah. Yes, we do have the flu. Okay, thank you very much.
Thank you.
But it should be, again, that's being finalized, and that's all pending. I need to see that myself and look forward to that, but it really should be similar to other viruses, that the similar cleaning supplies that would clean for those other viruses.
Operator,
next question?
Go ahead. Yep.
Yes, ma'am. Your next question comes from the line of Patrick Smith. Your line is open.
Hi, how are you? Actually, my question was answered. It was regarding the template, the letter that was sent out. We're kind of going back and forth if we should be sending that out, but you had answered that question. So thank you for answering that. Thank you for doing this webinar.
Great, thank you.
Your next question comes from the line of Brooke Balchan. Your line is open.
Hi, good afternoon, everyone. Thanks again for the update. We had a student return from mainland China on February 3rd, and based on the webinar we participated in on Monday, this child was sent home from the airport at JFK, and we have planned to keep the student out for 14 days. Our local DOH has not contacted us, and so after I get off this webinar, my intention is to contact them directly, but the student name has not been provided by the Department of Health. Based on the letter that was sent last night, the combined letter from State Ed and the DOH addressed to administrators, it says specifically that anybody who visited China and returned after February 2nd can return to school or work unless a local health department informs the school that the student or staff must comply with quarantine. So I'm very confused.
Thank you for that question, and we expected to have the clarifying information right now, so I appreciate that. As we stated about the dates, I think because that person was screened at JFK, I do think prior to making a decision about return to school, you should contact your local health department. If you have an issue contacting your local health department, you can reach out to us and engage on that specific situation. We do want to talk to you about that. So I think before changing the course of that direction, you would want to reach out. And specifically on that question and the answer here, because of the movement and monitoring restriction presentation today and what we've posted, we want to clarify that those risk categories and who are in those risk categories are recommended if arriving on or after February 2nd to stay home from school or work. So that would apply, assuming, the student you're talking about was on mainland China and was exposed within the last 14 days. There's a lot of ifs there, but all of those ifs can be worked out with your local health department. So if you can't reach them, let us know. But I think you did the right thing, and before changing course, I would reach out to them.
Thank you so much.
Your next question comes from the line of Abigail Haglund-Shen. Your line is open.
Hi, everyone. Thank you so much for presenting. I just had a question about staff that are returning from travel from China. That was new, and that wasn't in the guidance that the Department of Health locally will actually reach out to schools about staff. Can you talk a little bit about, I guess, how that process would work, if it would be any different from students?
Yeah, all adults coming through these airports will also be screened likewise and be advised that they should stay home for 14 days after their travel in China and not work. So they would be in that category of not attending work as well. Or volunteers, to be honest, staff or volunteers would fit in that category, adult volunteers.
I see. So if the school were aware of a staff member that had traveled, but they showed up to work anyway, that would be likewise a question for the local health department. Is that correct, or should it be different?
Exactly. Yep. Yeah, exactly.
Got it.
And again, the first couple days of this implementation, there were, things were a bit slower coming through, but we expect that it will be improved.
Right. I see. And I just had one follow-up question. In terms of local health departments notifying schools of students that are under mandatory isolation orders, they're not allowed to come to school, and they show up to school anyway, and the school has already been in touch with the Department of Health because the Department of Health, reached out to the school. At that point, if the child attempts to come to school, can the school exclude, or should they then call the Department of Health again to kind of confirm that?
That's a great question, and we've, of course, thought this through as well, so we're glad you brought that up. And so obviously the first thing would be really to touch base with the local health department just to make sure that everyone's on the same page as far as understanding. The vast majority of folks do voluntarily proceed with doing this to protect the public and their community. And right now, as we all know from this call, it's just been very fast moving and there's a lot of confusion. So the first thing would be to make sure that everybody's on the same page just as far as awareness, that there's no linguistic challenges that could be easily overcome with a translator or a language line. But if you find you're still in a challenging situation where there is someone who the local health department deems should be under a quarantine order and you do find them in the school setting, we have our lawyer here to answer how to approach it at that point.
Sure. This is Justin Pfeiffer with Legal Affairs Department of Health. It is really the local health department's role to be enforcing their own quarantine order. So that is part of the reason why we are directing you to them, and they will proceed with the enforcement actions. I will say that this quarantining people is not something that is routine. This is very new, so we are working very closely with the local health departments to get them comfortable with their enforcement actions, but that is their role. And I also turn it over to our SED folks if there's anything they want to add from sort of the SED perspective of saying shaking heads. But we are really relying on the local health departments to act as the enforcers of this rule. My understanding is that if a child is symptomatic, that becomes a different matter, but these are folks who are not symptomatic.
we are unfortunately going to lose access to the room that we are in right now, so we do have to wrap up. Thank you all so much again for joining us and for your questions. Again, reinforce that you should be working with your local health department proactively. It might make sense to reach out to them and check all of the websites for updates. And if we have updates or need additional clarifying information out to schools, we are working together really closely on that. So please reach out if there are questions or additional information that we can send and be updated. And this is continually developing, so we plan to continually keep you guys informed. Thank you all so much again.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect.